Care. Twelve minutes past 8 o'clock. It is Monday morning, the 17th day of April, 2023. Good morning, everyone. I'm Scott Michlin, and thanks for tuning in to KSJE 90.9 FM over the air, of course, here in San Juan County, New Mexico, 103.3 FM up in Durango, Colorado, and streaming everywhere else on the planet from our website, of course, at KSJE.com. Welcome aboard, everyone. We're glad that you are all with us this morning because coming up, a really important conversation about the 100% San Juan County organization. They are around, they have formed, and they are thriving and having their first summit coming up this week. We'll talk a little bit about that and what 100% San Juan County hopes to do, along with 100% New Mexico. That and more coming up in the next few moments right here on KSJE this morning. Later on this hour, we'll be checking in with Lewis Campbell from Synergy Computer Systems. We'll talk technology. That's our next segment coming up on the air today at 8:50 a.m. on KSJE. Mick Hess will be here next hour, roving with the arts. It is our long-running classical music program, of course. Mick is featuring music from Bach this morning, so we hope you'll stay tuned for that at 9:06. And a reminder that you can connect with KSJE on our social media platforms, including Facebook and YouTube and Twitter and also Instagram as well. And if you're a podcast person, this program, as well as many of our other local programs, become podcasts, and you can find them places where you're already probably listening to podcasts, places like iTunes and Spotify and iHeartRadio and Google Podcasts and Pandora. So we hope you'll subscribe for free and maybe discover a new local program that you may have missed. Outside our studios here at San Juan College, it is a cloudy morning so far, 42 degrees at the moment. We were expecting a mostly sunny and mild day today with a high in Farmington reaching 74 degrees. Clear tonight with a low near 42, but then the winds will pick up tomorrow to remind you that it is springtime in New Mexico. Windy day tomorrow with wind gusts up to 45 miles per hour on Tuesday and a high of 72 tomorrow. 48 for a low Tuesday night, then windy again on Wednesday, but cooler weather with a high of 64 and an overnight low of 33. Sunshine returns on Thursday with a high near 57. 58 on Friday, back up to 60 on Saturday, maybe upper 60s by Sunday. Well, let me introduce my first guest who is here with me this morning again to talk a little bit about 100% San Juan County and some of the things that they are doing here in the area. Tina Pacheco is here from 100% San Juan County, and good morning. Welcome back to KSJE.
Good morning, Scott. Thank you.
You are wearing a different hat today than maybe what we usually see you in, and that's okay because you're involved in a lot of cool things, this being one.
Yes. And in a lot of ways, it is the same hat, working towards just the 100% San Juan initiative, bringing a lot of different agencies together to help San Juan County families thrive. And, you know, my work in the nonprofit field is about that, and so it's a good fit for me.
Very true. Very true. But it's good to have you here to talk about this. And you are having your first summit coming up later on this week, which we know is full. And congratulations, and that's got to be very exciting to see so much support for what you are hoping to do.
Yeah, we're really excited for this first kickoff summit, just to educate each other and kind of start to build a vision on what this looks like. We have almost 70 agencies, representatives, 67 agencies total, and this is ranging from law enforcement, multiple school districts, tribal agencies, business leaders, elected officials,
right?
School district representatives, nonprofit representatives. So it's really a core group of people who are looking to move the needle for families in San Juan County.
That's wonderful. And so talk to me a little bit about the 100% San Juan County group and organization. It is certainly part of this 100% New Mexico. There are other entities like this starting up or have started in other counties throughout our state. And what is the mission of 100%? I know we've had Kathy Price on before, I think, talking a little bit about this and some other guests as well. But for folks who maybe aren't familiar with it, what is it and what are we hoping to accomplish?
So when the 100% initiative aligns services to families under 10 different sectors, and this ranges from, mental health care, medical care, food, housing, transportation, parent supports, job training, community schools. And, the concept is we align ourselves in these 10 different sectors. And if kids and families have access to these 10 things, they will survive and thrive. And by working together, we identify gaps, we identify opportunities to improve, and eliminate duplicate efforts. And the exciting thing, though, about this initiative, I think that is different from others, is that there's funding behind this. That should we develop projects through the work of the state of New Mexico State University, we're following a framework that is working in other counties, Chaves County, Otero County, Socorro County, a lot of different work that we've been able to collaborate, learn from them. And even though our county is very different from others, we're really gaining a lot of momentum.
Right. And so this organization is already underway and established in other counties, and each county kind of has its own leeway, I guess, or flexibility to kind of set up their 100% as they see fit and as to address the unique needs of their communities.
Sure, but they're all tied together in the fact that they're all aligned in those 10 key sectors,
right,
that have been identified to thrive.
Got you. And we see them on the screen right now. Mm-hmm. And so just for our radio audience who can't see them, let's just run through them really, really quickly of what those 10 are. I'm reading parent support, early childhood learning, community schools, youth mentors, job training, transportation, behavioral health care, medical and dental care, housing, and food.
That is correct. And, 5 of those are, obviously more urgent and what we call the 5 to survive, and then the full 10 is the to thrive, to really thrive, if everyone has access to those things.
Right. And a big focus is on youth and children, correct?
That's true. Yeah, it's all about youth and families, and really getting to the root of where where are they falling through the gaps? Instead of just putting a Band-Aid on the problem, is backing up to the source of, where we're missing out and where we can do better.
Right. Very good. Let me bring in our other guest who is with us this morning, and that is Dominic Capello. He is the author of the book Anna, Age 8, The Data-Driven Prevention of Childhood Trauma and Maltreatment. And Mr. Capello is joining us remotely this morning, but he can hear us and see us, I believe. And Mr. Capello, it's an honor to have you on the program today.
Great. It is. It's really it's a pleasure to be here. And I should add that I'm the co-author of Anna, Age 8 with Dr. Catherine Ortega-Courtney, and both of us are the co-directors of the Anna, Age 8 Institute, a program of New Mexico State University.
Very good. Thank you for that correction. My apologies, but thank you. And so talk to me a little bit about the book and your work here with 100% New Mexico, if you wouldn't mind.
Sure. Yeah. Well, gosh, it was about 5 years ago. Dr. Courtney and I were working at CYFD, Child Protective Services, and we were in the data unit. So we were not in the field. We were in the central office in Santa Fe. And this is the hub where you get all the data from across 33 counties. So we were looking at how many investigations were going on. We were looking at why do people come into the system. We were looking at what happens to children once they're in the system, what happens to families. And what we were learning was that a lot of families cannot get to vital services. And I think, as we all know, all our viewers know, if you can't get to medical care or behavioral health care, you're in trouble. And as we've talked about the 10 vital services, but I can't stress enough that if we don't have them, we don't do well. Our families don't do well. Our students don't do well. Parents, our caregiving grandparents, and ultimately the community doesn't do well. we connect the dots, right, between what happens to an individual child, what happens to an individual family, what happens to a community, and then what happens to a city and a county in terms of their economic engine and their workforce. So there's a lot to talk about. And so our experience back in the what we call the child welfare days, and also we had experience with public education and public health, we realized that we needed a framework, a way to help each county evaluate their current services, and identify the gaps and fix the gaps. So in some ways, it's as simple as that, and it's as complicated as that.
Very true. Interesting. And so it sounds to me that that it looks like in New Mexico we've had this problem though for it's a generational problem, I guess is what I'm trying to say, right? And this is going to be maybe some of the heavy lifting to try to change that.
This will be. I mean, it's been an interesting journey. We have about 17 counties representing the majority of the population of the state. We thought going out, Dr. Courtney and I thought we would have 3 counties. Once we started moving, a lot of local stakeholders said, I want to know about this model. I want to know about this framework. You know, we are data driven. We're not based on hunches or guessing. The first thing we do is go into a county and we do a countywide assessment. We're asking parents, to what degree can you get to these services? And what we're finding is about a third to half the population cannot easily get to the 10 vital services for surviving and thriving. So once we get the survey, we're not guessing anymore. We know where the gaps are. We know why there are gaps because we're asking, what are the barriers? Why can't you get to services? And so this is probably one of the most groundbreaking initiatives in the United States in that we're looking at what's called, as they say in public health, the social determinants of health. We're looking at the services that determine the health, education, and quality of life of children, students, and all family members. So it's a pretty amazing initiative to be involved with. It's incredible in terms of collaboration, imagination, innovation. A lot of private public sector partnerships are being developed because there are incredible opportunities. And there are tons of great people already working in every county. What we do is use technology to bring all of them together, put them in alignment, and be efficient, and really give every resident in San Juan County a really good user experience.
And it sounds to me that it's really important to have that public-private partnership, because it seems like this is a problem that maybe government can't solve on its own, maybe private or nonprofits can't solve it on their own. You really do need that cooperative effort.
You really do. And I mean, you know, my favorite number, I guess percentage would be 100%. I think for a long time, and as you mentioned, Scott, you know, the problems we're talking about here and across the nation are not new. You know, lack of services is not new. I should also mention all the problems that come with lack of services. First and foremost would be adverse childhood experiences. A lot of kids enduring a lot of adversity, abuse, and neglect. A lot of parents struggling with a lot of untreated mental health problems. I could go on and on about our list. But if you go back to the social determinants of health, meaning the services that determine the quality of our life, if those services are in place, everyone does better. And as you said, this is not a finger-pointing exercise. It's not, well, City Hall didn't do this, or county government didn't do this, or where was the school board, or what about child welfare, and where the heck is public health in all this? We're not pointing fingers. What we're doing is all of us are the solution. 100% of us in a county, that's the solution, serving 100% of residents. So I think I have t-shirts. 100% is all of us.
Very good. Very good. And And I guess the other important thing that Tina pointed out as well is that there are some dollars to back up what you are talking about, what you are striving for, and things on that line. Because many times I think we hear a lot of these well-meaning ideas and organizations that want to bring folks together, but they really don't have the dollars to maybe back that up. And in this case, it's somewhat very different in that you do have some money to help make these things happen and make these organizations use that technology as you mentioned to maybe solve some of these or work towards solutions for many of these problems. Correct?
It is correct. We have with NMSU, and thank you to our state lawmakers who have been giving us some planning money, seed money, I would like to call it. But Scott, what I'd like to stress about lack of services, it's never been about the money. You know, we have $1 trillion federal budget, $1 billion state budget. Our cities and our counties are $1 million budgets. It's never been about the money when it comes to our kids and getting services to our kids. What it's been about is the priority. So we don't lack for money at all, as a matter of fact. Money exists on every level of government and through philanthropy. And there are a lot of people interested in helping us, but what they need to see is the vision. What's the vision from each county? Can county stakeholders come together? Can they agree to work together? You know, a lot of people work and are paid to work to do this work, as a matter of fact, but they've been siloed. Everyone's been kind of doing their own thing. What we're doing is bringing everyone together, helping each sector make a proposal. I mean, if San Juan County wants a 100% community center, which is a one-stop service hub for every parent and family member in their county, if they want that, then our job is to work with them, the stakeholders, make a proposal, and get that proposal to the right level of government or all levels of government. So again, I want to stress, it's not about the money, it's about the priority. If our kids are the number one priority, we're going to get the money. And as I said, there are such opportunities for public and private sector innovation that can do amazing things. So I'm really excited about the opportunity here. And as Tina said, you know, we're in 15 counties. I think we're in 17. It's hard to keep up. But all these counties, think of them as experiments. They're all customizing the process to get to the final result, which is 10 vital services for 100% of families.
Right. And you are going to be here later on this week to talk at the first 100% San Juan County Summit and share your ideas and your enthusiasm for this partnership. And so I know a lot of folks are looking forward to hearing from you and learning more about it, and certainly about the book that you co-wrote with your partner, which talks a little bit about some of these things that we are talking about this morning, correct?
Correct. I believe everyone coming to the summit is going to get an author's copy of David, Age 14. This is the follow-up book to Anna, Age 8. And Dr. Catherine Ortega-Courtney and I recently got that out the door. And it's, it continues the story of our vulnerable children. I think most people know, or many of our listeners know, that with Anna, Age 8, our first book, we were looking at a little girl who fell through the cracks. And she didn't make it to her 9th birthday. But the story of Anna, Age 8 is really a story of let's be brave enough to look at the problem and address the problem. David, Age 14, continues the story with another character. And I should add that Anna and David are fictional characters based on very real children. But David's story is about what happens when you are not a child fatality. What happens when you keep living in a world of trauma without services? And the first part of the book, gives you his story and his family's story and his community's story. But what I like about David, Age 14, is if you make it, you got to get through the first half, because the last half is all about now we come together. Now we know what to do. So I think it's a book of empowerment, and I'm very excited to come to your beautiful county And did I hear that it's 85 degrees? I want to make sure. I want to make sure that I'm not bringing a winter coat if it's going to be summer up there.
Not summer yet, I think, but I think
All
if you
right.
dress for maybe 70, you'll probably be in good shape. But
All right. Good. Good. I'm very happy. I'm honored to be invited up, and I'm very excited. 100 people in a room with a shared vision. There is nothing more powerful. Nothing. Nothing. It's going to be transformative.
very good. Well, we're thrilled to have you with us this morning. Let me go back to Tina Pacheco to talk a little bit about this event, which is full, and we'll be hearing, I think, more about this 100% San Juan County organization as time moves forward. And you are bringing together nonprofits and other individuals and Mr. Capello to really kind of, I think, kickstart some of these efforts in the community. Tina.
Yes, that's true. And, like I say, we are encouraging people, if you want to get involved, please, reach out to me. I'd be glad to talk to you more about it. Visit the 100% website. It's 100nm.org. And learn more there. We also have a service directory there that we are actively listing services by the sector that they fall in, and we're checking up on emails and contact information daily. It's we have hundreds of agencies on there. And also, Anna Age 8 is available for a free download. So if you want to read that book, I would really encourage you to do it. And then, later on, we're going to be holding book clubs for David age 14. And I was involved in an Anna age 8 book club. And it was really some deep conversation on really what real life San Juan County kids are going through. There were teachers involved. There were several different agencies represented there, and it's just a really good picture and a good way to frame that discussion. And so we would invite the community to participate in that.
Very good. And from this event that's coming up this week, what do you hope comes out of it? Some enthusiasm, some action? What are you, in a perfect world, what are you hoping for?
Well, in a perfect world, we are looking to establish working teams under each of the sectors. And you do not have to attend the summit to volunteer to be part of this team. And, we are creating this energy as we go. There's some teams that are going to be, we have leaders for several of the teams. I'm personally working with youth mentoring. Michelle Meyering with the Boys and Girls Club, Aaron Gokul, Carrie Olson, Lynette Spence, Nanette Pickering, Barbara Tedrow, all are team leaders. And, identify one of these sectors that you feel passionate about or you have experience with and come to the conversation.
Okay. All right. Very good. Mr. Capello, I want to ask you the same type of question. After this summit, what do you hope 100% San Juan County will be able to do? Maybe you've seen this in other counties as well where this organization has gotten started, but what are your hopes?
Gosh, well, what we've seen in other counties has been really interesting. There's something that happens when you get representatives from 10 sectors in a room. When you work in the public sector, you usually are in your silo. So behavioral health care people stick with behavioral health care people in general. Transportation people stick with transportation people. One of the most interesting comments to come out of one of our first summits, this was down in Doña Ana County, was the behavioral health care person said, I've never been in a room with anyone from transportation. And it was interesting because as our viewers, as our listeners know, if you don't have transportation, you're not getting to behavioral health care. So it's interesting when you look at that little circle of those 10 services, they're all connected, which is why a summit brings representatives from all these sectors together. That is incredibly powerful. Getting people talking across sectors, within sectors. And so what we've seen from our summits is that you end up with people in 10 sectors. You end up with participants in 10 action teams. And that's where the work starts. We're doing this to move to action. We've got data, we've got research, but our goal is to get these 10 sectors up and running, each sector can look at how will they fix the barriers. And our job as with the university and with our collaboration with other universities like UNM would be to really zoom in and help every action team with any innovative idea they have that can reduce a barrier. So the bottom line is it's relationships. So 100 people in a room, 100 caring, innovative people in a room, that's powerful. And that's what's going to happen. So I'm really excited about this.
Well, we can tell, and your enthusiasm and passion for this topic is infectious, and so I really appreciate you joining us this morning to share some of that with us today. Mr. Capello, thank you so much.
Oh, thank you.
You bet. Great to have you on the program. And Tina Pacheco, just final thoughts about this organization. Again, the summit will be happening this week. It is full, but the community will be hearing a lot more about 100% San Juan County in the weeks, months to come.
Yes, that's true. And like I say, go to 100nm.org and check it out. And like I say, we want everybody there, so everybody at the table. So
all right, this is the first summit, probably not the last, is
correct.
My thinking.
There will be more summits.
And probably room for more people.
Yes.
Okay, very good. Great to see you. Thank you for coming in this morning. Thank you for all your involvement in all the things, all the hats that you wear. Some different, some not so different, but thank you very much.
Thank you.
Good to see you.
Bye-bye.
My guest this morning here on KSJE. KSJE and San Juan College present the Student Success Coaching Tip of the Week. Week 13, Review and Reorganize. Whether you're using a notebook, a laptop, or a good old-fashioned flashcard, reviewing each line of your notes helps ensure that you hit all the right information you reviewed in class, and might even remind you of a few things you would have missed otherwise. It's good to review notes shortly after class, and then again a few days later. This allows you to take a break between edits and come back to the information with a fresh perspective. The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.
The problem of bias in artificial intelligence is more than a glitch. From American Public Media, this is Marketplace Tech. I'm Megan McCarty-Carino.
Marketplace Tech is supported by Angie, dedicated to helping homeowners get home projects not just done, but done well. Reviews, pricing, and booking at Angie.com or on the Angie app. And by The Uncertain Hour, investigates the privatization of welfare and how for-profit companies cash in on public benefits. Listen to The Uncertain Hour wherever you get your podcasts.
Artificial intelligence is practically all anyone in the tech world can talk about